What I do is I'm the orthopedic trauma surgeon, part of the department. What I do is basically I run the trauma service at the hospital. So any type of traumatic injury or very complex cases that may come to the hospital, it falls in my realm of practice. When we treat patients, we're not just treating an x-ray, we're not just treating what we see or an extremity, we're trying to treat the whole patient. So in addition to fixing the obvious fracture or other injury that a patient may have, we have to treat their well-being. We have to explain things to them, make sure they understand what the treatment options are, and we have to understand what they're going through as well, so that we can empathize with them and make sure that they're okay as a whole. Empathy, I think, means doing your best to put yourself in the patient's position. I think if you do that, it gives you the best chance of trying to go through the same feelings that they're having and try to understand that it's a difficult time for them, and that allows us to basically do our best to make sure that they make a full recovery. Well, the new Bone Joint Center is basically an effort to create a one-stop shop for patients. We try to provide at least all the subspecialties within orthopedics, but also there's radiologies in the building. We have a surgical center in the building as well, so it makes it a lot more convenient and easy for patients to get all their care in one place. So I grew up in LA in California, lived there until I was about 17, moved out to New Jersey with my family, ended up going to undergraduate and then medical school in New Jersey. Then did my orthopedics residency in New York, here in Brooklyn, at Maimonides actually, and left a year to complete my subspecialty training in trauma, and then returned as faculty here.
This is the only facility where we provide both orthopedic care as well as spinal care in Brooklyn. This is one shop. We offer not only non-operative treatments, which include physical therapy, pain management, we also offer patients diagnostic tests such as MRIs, CT scan, X-rays, fluoroscopy, as well as neurophysiologic testing, where people know them as EMGs. We have different type of orthopedic specialties, including, as we said, spine, hand and upper extremities, shoulder, sports specialists, both non-operative and operative physicians. We also have doctors who deal with arthritis, such as knee arthritis, hip arthritis, and therefore we also offer those who are expert in reconstruction surgeries. I've worked at NYU and New York City for 15 years. I've decided to come to Brooklyn. You should be happy and comfortable where you go, and I can assure you that you could get that in our facility. I'm originally from Iran. I came to the States in 1988. I did my undergraduate studies at Yeshiva University, and I followed that with a medical school at Albert Einstein College of Medicine. Subsequently, I did my residency in orthopedic surgery at NYU Hospital for Joint Diseases, and I did my spinal surgery fellowship at the same place at NYU Hospital for Joint Diseases. After my residency, I became a faculty at NYU Hospital for Joint Diseases, and I practiced there for 15 years.
We like to focus on patient care and really informing patients specifically on their disease pathology and making sure when they leave here, they don't say, I don't know what's wrong with me. We want to make sure they understand what's going on, they understand the treatment plan, and more importantly, that they're part of the process and that they have some sort of input as to what's going on with them. We're not just telling them, this is what you have and this is what we're going to do. So I think that's an important part about what we do here. I was born and raised in New Orleans, Louisiana. I did my undergrad and medical school at Tulane University. I did 1 year general surgery also at Tulane Hospital in New Orleans, and then I did my orthopedic training at Maimonides Medical Center in Brooklyn, New York. And I did 1 year shoulder elbow surgery at San Francisco Shoulder Elbow Hand Clinic, where I trained in complex shoulder reconstruction procedures, and I decided to come back to Maimonides to fulfill kind of a lifelong dream to be an orthopedic educator. At Maimonides, we have kind of a unique setup where we're partial in academic practice and also a private practice. I came back for the academic part of it just because I love teaching. Besides teaching our patients on a day-to-day basis about their pathology, it's nice teaching future orthopedic surgeons how to diagnose disorders, how to treat them conservatively, and especially how to treat them with operative procedures. It's so fulfilling, and I've had great mentors in my life, and it's nice to give back. So it's one of the reasons I came back. I practice mainly shoulder and upper extremity surgery. I did a fellowship specifically in shoulder elbow surgery, but I do treat disorders all the way down to the hand. But my primary interest is in shoulder arthroplasty and shoulder reconstructive procedures, as well as shoulder arthroscopy. I would say don't ignore it. If your body's telling you something in your shoulder and you feel something's wrong, get it checked out. For the most part, young healthy people don't have too serious problems with their shoulder, but given time, if you neglect something small, it can later turn into something that needs a much bigger surgery than if you had it taken care of earlier. So I would say listen to your body and get it checked out. Shoulder surgeons, for the most part, are nice physicians, and you'll feel better after you have a nice visit with them.
What I loved about orthopedics specifically is that you can make a tangible difference in someone's life, and you actually see your result fairly quickly. To me, it's one of the things that really drew me to orthopedics, something such as a hip replacement or a knee replacement where people have a lot of pain, and you could get rid of that pain in a very short period of time. I was lucky enough to kind of see the kind of birth of the Bone and Joint Center when it was initially being put together by Dr. Schwecka. And what he's developed is a team that's kind of all-inclusive in orthopedics, so essentially there really isn't any problem relating to orthopedics that we really can't take care of in this area. And the reason we come here every day is to provide high-quality care for our patients. When I think about the Spine Center and what our goal is and what we want to accomplish with the Spine Center, the goal is to create an area where patients could come and receive all their care for their spine that they may need. Starting with non-operative care, including physical therapy. If they require injections, they could get it here as well. And ultimately, if they ever require surgery, that's why we're here. So the goal of the Spine Center is to have a place where patients are comfortable and confident that they're receiving the best care in all of New York City, and that they are getting all their care under one roof. So I'm actually a native New Yorker. I was born and raised in Queens. Kind of grew up in Queens. And I've done a lot of my education in and around New York City. I went to high school in the Bronx, at the Bronx High School of Science. I did my undergrad at the City College of New York in Harlem, New York, at the Sophie Davis School of Biomedical Education on the City College of New York campus. And then I went to New Hampshire briefly for my medical school at the Dartmouth Medical School. And once I was done with medical school, I got the chance and the opportunity to come back to New York City, here in Brooklyn at Maimonides Medical Center, where I did my residency. So I spent 5 years doing my orthopedic surgery residency here at Maimonides, and then I went for my 1 year surgical fellowship in complex spine surgery at the University of Rochester in Rochester, New York, and then I got the opportunity to come back as an attending here at Maimonides.
So I do non-operative orthopedics. I treat all sorts of conditions from acute sports injuries, chronic injuries, arthritis, using different modalities, different non-operative treatments, and pretty much all ages. I think that being in a field that doesn't have as many women as some other fields, it allows me to really reach my full potential, do what I can for my patients, and hopefully show other young girls who want to be something that they can be what they want. I've also found a lot of acceptance in this field, and a lot of people really like that I'm a woman. I think that it puts me in the unique position to really treat a lot of different things. I also do emergency medicine, and that's really a very big variety, and I get to treat various stages of illness from acute to chronic. And in sports injuries and orthopedics, I get to help people, make them feel better. We have a fantastic office. It's brand new. It's got state-of-the-art, everything from diagnostics to imaging to the office itself. It's absolutely beautiful. And we have a full team covering pretty much every aspect of orthopedics and sports medicine that we can imagine that people would need. And people really can come here and get a full range of services. There wasn't one specific, aha moment that this is what I'm going to do, but I looked around and I, did a lot of research and tried to find my way, and I wanted to do something that helps, that makes a difference. So medicine was a good fit for me, and then I eventually turned to sports medicine.
My specialty is hip and knee reconstruction. So I do hip and knee replacements for patients with osteoarthritis. Within orthopedic surgery, we have different specialties. We have shoulder, hand, hip, knee, foot and ankle, spine, pediatrics, and we have everyone here. All the specialty we're covering here, and we talk to each other constantly for feedback and opinions and for treatment options and stuff. As orthopedic surgery, we would like to get them back to where they were in the past. As I keep telling my patients, to do surgery is not about me or about the x-ray, it's about them. It's about them trying to get back to where they want to be. For orthopedic surgery, it's all about for them to get the function back. I was born in Canada. I grew up in Hong Kong, and I came back to Canada for college in 2003. And then I went to Georgetown for medical school, and then came to New York for residency and stayed here since then. I always want to come to the area that I can serve the Chinese population, because despite that I did all my training in the United States, I grew up in Asia. So I would like to treat this population, and I would like to provide care to them.
Welcome to the Maimonides Medical Center joint replacement video. I'm here as a joint surgeon to teach you a little bit about what you're going to go through in the next couple weeks to months. You will meet physical therapists, anesthesiologists, caseworkers, and some joint surgeons. You will also be meeting one of our patients. He will be able to explain to you how he went through the process and how well he did afterwards. We're here to make your hospital stay as well as your transition to home as easy as possible. Joint replacement surgery is one of the most successful surgeries that we have in orthopedic surgery. This also allows patients to spend time outside, enjoy sports, and do things that they hadn't been able to do before. A lot of these patients have been in pain for many years, and they come out of this whole process very happy. Let's take some time to meet some of our surgeons.
Maimonides Medical Center is the place for total joint replacement in Brooklyn. We have excellent medical team, including doctors, nurses, physical therapists. We all strive to bring you back home after surgery. We will make sure that you meet all your needs before you leave the hospital. For example, let's say if you have to walk stairs at home, we'll make sure that you will have stairs training in the hospital. Eventually, when you get home, you feel comfortable. You will have your home physical therapist with us, as well as the home nurses to come see you at home.
Hi, I'm Dr. Joseph Felicia. I can tell you, I've been practicing for over 35 years. I have a relationship with patients that I feel is significant. I'm able to discuss issues with regard to joint replacements. I'm going to tell the patient what the surgery is about, what the surgery will mean to them, what a realistic outcome will be, and come up with a treatment protocol to get the patient functional after the surgery in the shortest period of time.
My name is Dr. Victor Sasson. I'm one of the orthopedic attendings in Maimonides Hospital. I do perform a significant amount of joint replacements. We have a whole team approach in the Maimonides Hospital. I'm very comfortable operating in Maimonides Hospital. I think the nursing staff is excellent, the operating room staff is excellent, and the post-operative care is excellent. Patients are quite happy after they leave the hospital and during their length of stay during the hospitalization.
I believe optimally patients should go home with home physical therapy. Physical therapy and home care services have dramatically improved over the past few years. Most patients recover best in their home environment, which is a protected environment, safe, with the least possible complications associated with infection.
We work with an anesthesia team that's there with you before the surgery, during the surgery, and after the surgery.
Hello, my name is Gary Schwartz. I'm an anesthesiologist and the Director of Acute Pain Management at Maimonides Medical Center. My job is providing pain relief to patients before, after, and during surgery for total joint replacements. One of the most common questions we get asked is, how is our pain going to be managed before, after, and during surgery? Usually we give our patients a cocktail of medications prior to undergoing their joint replacement, including a multimodal analgesia. Multimodal analgesia is the process of giving a few medications to help relieve patients' pain while minimizing the side effects. Prior to going in the operating room, your anesthesiologist will talk to you, and then they will discuss giving a spinal anesthesia. What that entails is numbing the lower half of the body for your joint replacement by injecting some local anesthetic into the spinal fluid, not into the spine itself. That does not mean you're not going to be awake for the surgery. The anesthesiologist will sedate you for the procedure, but you will have no pain from below your abdomen area, so you can recover from your total knee and total joint. After that part of the procedure, the anesthesiologist will place a nerve block to block the nerve of your knee or your hip to decrease your pain after the surgery. From that point on, you'll go to the recovery room and our acute pain team will follow you while you're in the hospital to make your stay comfortable, allowing you to get up faster from surgery, wake up faster, and get back to your normal routine. We will then assist the surgeons after the procedure to give you medications on the way home so you could recover in the comfort of your own home.
Following surgery, you'll meet some of our wonderful nursing staff. They'll be able to transition you to the next step.
Hello, my name is Ilana Fuchs. I'm one of the staff nurses on the orthopedic unit here. We strive for safety, pain control, and to get you back to your daily life as soon as possible.
Hey Mary, how are you? I'm Fabio. So basically this unit is a unit that after you have surgery that you come to recover.
Right.
All the patients that have any sort of surgery on their hips, on their knees, or any kind of fracture will come here afterward.
Okay.
Our usual plan of care is, first of all, to control your pain. One very important aspect of your recovery is to get you up and about. We try to do it same day if possible. Other than that, we guarantee you to get out of bed the next day.
My goal is to make them feel comfortable, secure, and confident with me, because I think that's what helps the healing process.
Every Monday we have a comprehensive joint replacement class. That is for a patient is scheduled to have a joint replacement. They come to observe the hospital. They're going to look at the stay, where they're going to be staying, the rooms they're going to be staying, what kind of care they're going to be provided, what their expectations are preoperatively and especially postoperatively.
What I'm going to discuss today is what to expect when expecting surgery. So they will call you the night before usually to let you know when your surgery is going to happen. You will come in, you'll be prepped, you'll go in for your surgery, okay? Hi, my name is Alexander Gross. I'm a senior physical therapist here in Maimonides. My role is to get you up and moving as soon and as quickly as possible so that you can have a speedy recovery. They're usually lying in bed, and we take their blood pressure, we make sure they're okay, and then we start to begin the process of teaching them how to get up out of the bed, how to stand properly, and then how to then start walking and introducing weight to the joint that they've had replaced.
This is called a trapeze. This is attached to your bed. After you have your total joint surgery, you're going to be using this device to help yourself in the bed, whether it be to lift yourself up to put a bedpan or lift yourself higher in the bed. This is going to help with mobility in the bed.
The day of surgery, we call it like post-op day 0, the same day, 2 hours after we leave the OR, we walk our patients. It's very important for us to walk the patients, to give them a very strong psychological support that they can actually walk after surgery.
They should expect to be working with physical therapy very diligently, moving their new joint, introducing movement to their new joint, start on working on range of motion at the joint, and then progressing to strengthening of that joint.
Home care services, the nurse is going to come to your house. She's also going to assess your house.
Case managers will be an integral part of transferring you from the hospital to your home.
My name is Esther Wallace. I'm the nurse case manager. Following your procedure, I will be discussing with you what to expect when you go home. We will try our best to have every service in place, whether you need physical therapy, whether you need a home attendant, a nursing to see you at home. We will make sure you get the equipment and everything you need to make sure that you are safely transitioned to your next level of care. What we like to do here is almost immediately following, we will start planning discharge so that the patient and the facility have enough time to properly have services in place. We'll get an idea of their home and their living environment. We'll get an idea from the doctors, from the medical standpoint, what they need once they're discharged. And we can also check with their insurance to see what they're able to get and what we can get them.
The best place for a patient to recuperate is in a comfortable environment. An environment where he's not exposed to pathogens, bacteria. Your body is quite comfortable living in your home environment.
I emphasize home care because going home, first of all, they're more comfortable going home. It's their own place. And second of all, we send them our nurses and our physical therapists have one-on-one care with them at their home for almost 80% of the stay for the first 2 weeks at home. From my experience, patients truly enjoyed it compared to patients who go to rehab.
With advancements in joint replacement surgery, we've learned that patients do better by going home. We're able to get you more comfortable, as we'll have people to assist you when you're there. You'll be meeting Arthur, one of my patients today, whose #1 goal was to get back to riding a bike.
My name is Arthur Hovden. I'm a successful patient of a total hip replacement. I went online and I found Dr. Eretz and I heard him speak on a short video. I made an appointment, and when he walked in, I was very pleased. Having this fear, I needed somebody to make me feel comfortable. And he worked with me from the beginning. He asked me what my issues were, and he made me an appointment that he found very soon, so I didn't have to wait. When I went in that morning, I was there at 5 o'clock, and we prepared. I had some strength. I did view the operating area, so I felt comfortable. I knew where I was, and I was able to go through with the surgery. And I felt confident because I know I was always a strong individual. One thing that really pushed me over to accept the surgery, he said, "I'll make a deal. If you can walk the next morning, I'll let you go home." Because I was anticipating a long stay in the hospital. So I kind of hinged on that. It helped me. And the way he was willing to work with me. The morning came. The next morning I was home by 1 o'clock. The woman in charge of the walkers, I guess the rehabilitation, come up and gave me a walker. And she asked me to walk to the, I guess the desk there where all the secretaries were. Man, did I walk there and I walked back quickly. I probably covered about 60 feet. And I was successful because the word I asked, the question I asked this woman was, "Are you sure I can walk on it? I fear it's going to break or something like that." And she says, "You know, a lot of people ask me that to trust the operation, but boy, it's held up. The fact that I can have home cooked meal and my sons come over and I watch some television, and you know, I was glad. I was proud of myself. I was able to endure the situation. Then I would come for a periodical checkup every 6 months, I think it was, and I had some questions. You know, how long is some of this little pain is going to work, or when can I get the normal swing in the step when you walk? It comes. I was walking with a little moderate pain, say for if I do 10 or 15 blocks or something, go to the hardware store. You know, you have a little something to deal with. A little over 2 years now, and I'm walking nice stride. Find somebody you feel confident with. Don't be afraid to ask questions. Perhaps even give me a tour of the hospital area. Can I feel comfortable? Ask questions. Ask, well, this bothers me or that bothers me. I never looked back after the surgery. I was riding a road bike in 8 weeks. Now I'm doing 150, 200 miles a week as I always did. I think you'd be doing yourself a good service if you choose to want to feel well again. It is possible. My family was proud of me. I was proud of myself. There's no reason to live with this pain. You have to help yourself a little bit after surgery, but I think you'll be very happy with yourself. It's an investment in your well-being.
Now that you met our team, I hope that we've been able to allay some of your fears and educate you about the process that lays ahead. Joint replacement is a very successful surgery that takes time, effort, and a coordinated team. We're here to work with you through this process and have a successful surgery.
I've always had a concept that the people of Brooklyn deserved a better place to get their orthopedic care. I was born in Brooklyn. I was born at Maimonides Medical Center. I absolutely love Brooklyn. There's no place like Brooklyn in the world. People in Brooklyn are a unique group, and I think the group we have here fits that perfectly well.
So I'm actually a native New Yorker. I was born and raised in Queens. What I loved about orthopedics specifically is that you can make a tangible difference in someone's life and you actually see your result fairly quickly.
I want to make patients better, truthfully. I really want to see patients that weren't walking or having trouble walking, walk again. I want to see patients that play sports and can't play sports because they injured themselves, go back to their sport. So that's one of the most rewarding things that I have.
When we treat patients, we're not just treating an x-ray, we're not just treating what we see or an extremity, we're trying to treat the whole patient.
I think that's very important. Bedside manner is how you connect to the patients.
There's not one patient that can come in here and not feel like they're at home and feel like they can get the care they need. We're very sensitive to cultural demands of our communities, and I think that's what separates us from a lot of other practices.
This is the only facility where we provide both orthopedic care as well as spinal care in Brooklyn.
Pediatrics, trauma, reconstructive surgery, oncology.
I mean, what we're trying to create here is kind of a one-stop shop for orthopedics.
It's a very pleasant, modern, clean, happy, bright place.
A full team covering pretty much every aspect of orthopedics and sports medicine.
I feel the facility is excellent. We offer a very good quality of orthopedic care.
We strive to be the best in New York at what we do. We like to focus on patient care and want to make sure they understand what's going on, and more importantly, that they're part of the process.
The Bone Joint Center is an all-inclusive, comprehensive center for all of your orthopedic care. My name is Jack Schwecka. I'm the chairman of orthopedic surgery at Maimonides Medical Center. I am an orthopedic surgeon who specializes in hand and upper extremity surgery. That's anything having to do with anything from the fingertips up across the wrist, the elbow, and the shoulder. I've always had a concept that the people of Brooklyn deserved a better place to get their orthopedic care. A place where they can come and see a great doctor, get the therapy they need, get the surgery they may need, get the imaging they may need, everything they need in one place so that they don't have to travel to a million places to get their care. And that's what the Bone and Joint Center is about. is you come in, it's a beautiful facility right in the central part of Brooklyn, and you get everything you need for orthopedics, all in one place. So we built the center in a really central part of Brooklyn. It's right on Bay Parkway and 60th Street. I mean, it next to buses, trains, mass transit, everything you need to get here. And it's right in the middle of many different neighborhoods in Brooklyn. There's a Midwood section, the Bay Ridge section, Bensonhurst section, Borough Park section, all come together in this one area. So we really service quite a varied group of patients at the Bone Joint Center. And that makes it very exciting. Right in the building, there's a beautiful ambulatory surgery center. It's state-of-the-art. It's absolutely beautiful. The staff is so friendly and compassionate, and people actually enjoy coming in for surgery. They say it's one of the best parts of their care. The Bone and Joint Center is an all-inclusive, comprehensive center for all of your orthopedic care. Beautiful facility that caters to the people of Brooklyn and offers them absolutely incredible, state-of-the-art, expert orthopedic care.
So the new center is a comprehensive center. It's a center that you can have any type of orthopedic care taken care of by a fellowship or well-trained physician taking care of that. We also have ancillary ability here. We have the ability to do surgeries, the ability to do MRIs, ability to do physical therapy. We have everything possible here, so you don't have to go anywhere else, which I'm pretty impressed. There's not really many other places like that in Brooklyn or even New York. People here really care. Everyone wants to help patients. This is a patient-centric type of place where if patients are having problems, we all work together to try to improve that patient's problem. Everyone is part of a team, and that's what we're going for here. I want to make patients better, truthfully. I really want to see patients that weren't walking or having trouble walking walk again. I want to see patients that play sports and can't play sports because they injured themselves go back to their sport. So that's one of the most rewarding things that I have, because at the end of the day, seeing someone return to something that they wanted to do, that's great. So I wanted to be an orthopedic surgeon because I like the idea of mechanics, and I like the idea of sports, and kind of putting science with that allows me to help people that are active, people that want to be active. So taking people that weren't active before and making them active, it's a great feeling.
I'm a pediatric orthopedic surgeon, so my practice involves the care of children, from young children at birth or just after to adolescents. And I take care of all manner of pediatric orthopedic problems and their care, from fractures to developmental irregularities to tumors and the like, growth disturbances. It includes a great number of different problems when you take care of children. So we cut across all the anatomic areas as well. I specialize in children, where most other specialties confine themselves to an area of the body. The pediatric orthopedist usually takes care of all parts of the body, but in that age group. My treatment philosophy is being a minimalist. I think that what we attempt to do in children's orthopedics, I think most people, not just myself, attempt to do, is treat the patient to accomplish the resolution of their problem with the least invasive, the most simple form of treatment. So I think the philosophy is do the least amount that accomplishes the task. And also to minimize the chance that there'll be complications. So minimalist, I think, is my philosophy. I get to work with a lot of younger people, Being one of the more senior members in the practice, I get to operate with, commiserate with, discuss and consult with younger people that are younger, more recently trained, maybe have some other creative ideas that I'm not aware of, and that's fun. I think that you could be assured that by coming here, you'll be able to get excellent care by whatever physician is most capable of caring for the problem that you present to us with. and you'll be able to get the most modern, up-to-date treatments, and it will be done in a caring, careful way.
Basically, I'm an orthopedic surgeon at Maimonides Medical Center. I've been here in private practice since 1979. I feel that over the years I have become, as far as my surgical abilities, I have something to offer the patient, that I can do something and I can do it correctly, and it's based on what I've done over the years. I have a wealth of experience, and it's a no-nonsensical approach, and I think my results pretty much say that. I was an orthopedic resident here after medical school in 1974. I am one of the old dinosaurs in orthopedics. It is a very exciting thing for me to watch what has happened in orthopedics over time. Because when I started, if you broke your femur bone, and basically this would be considered a major, injury. You had terrible pain, you couldn't walk, you were totally disabled, you showed up in the hospital. Originally, you were treated in traction. A pin was put in your leg, you hung a weight over the bed, you laid there in bed for about 6 to 8 weeks, you had x-rays every week. Now we can fix bones where you come in with a femur fracture, you can pretty much leave the hospital within a couple of days. I mean, you can walk on it. Within a very short period of time, you can return to a functional level of existence in an extremely short period of time, which is just remarkable. This is what has been exciting over the years.
Our celebration of champions of healing and bringing together our community is really a recognition of people as people, and that's the essence of Maimonides.
Maimonides Medical Center looked at Brooklyn and saw that in a city of 3 million people, there were almost no cancer services.
I believe Maimonides was the first institutions in the United States that purchased the robot and started using it for cardiothoracic procedures.
I would put our center up against any center in the city, the state, the country, or the world.
We are the largest NICU in Brooklyn. We deliver the most babies in New York State.
We were the hospital where the first heart transplant was performed, and we were the hospital where a lot of other firsts were performed.
We're the only children's hospital in Brooklyn. The department and my division, we focus a lot on family-centered care.
The message, no reason to go anywhere else.
I came to Maimonides because I think that it's a very important hospital. I always felt that the hospitals in Manhattan, if a patient didn't like their hospital, they could walk to the next one, even if they were in the middle of a heart attack. Here in Brooklyn, Maimonides is the key hospital to the health of this borough.
So we have a program which is a community outreach program. It's a program called Women's Heart to Heart. We go out to the community. We provide screenings including carotid ultrasounds, echocardiograms.
Maimonides Medical Center will actually be the lead center for this national aortic device trial.
So our LVAD program, we started in 2012. It's an implantable pump. We work together with our cardiac surgeons in the program.
What's unique about cardiac services here at Maimonides Hospital is the team approach that we take, the way that cardiology and cardiac surgery and vascular surgery work together for the good of the patient. That has resulted in overall great results for both cardiac surgery and cardiology.
When it comes to cardiac interventions, year after year, we are better than most of the state, and most of the years we are the best of the state. When it comes to heart failure and heart attacks, We are consistently one of the top 1% hospitals in the United States. And when it comes to heart attack mortality, we are always top 10 in the United States, and several times we were #1 in the United States.
Everything we do comes back to our patients. The highlight has to start with the patients and end with the patients.
You know that this is his job, but aside of being his job, he's human and he shows you that side. And he's compassionate and he's caring.
So the goal in building Brooklyn's first, best, and only breast cancer team was to recruit for values first and then ability. And so we looked at emotional IQ, we looked at empathy. We can't teach empathy. A person has empathy or not.
Thank you. Thank you for starting this program here. Thank you for giving women like me a chance to fight.
And we have built a huge network with all sorts of social service providers to deliver and start to organize a better form of
learning, leadership, planning, teamwork. Those are all vital to a hospital like Maimonides. But there is another quality that is required, and that's stewardship. Stewardship is the vision to see the fundamental importance of providing the highest level of care and providing it to the residents of Brooklyn.
The most important thing that really drives us is the patient care and being able to, we deal with children when they're at their most vulnerable and when they're at their sickest, and we like to be there for the kids and their families in that time of need, and that's what really drives us to do what we do. I think what's really special about Maimonides is we have expert care, the same level of expertise you would find in all the other major children's hospitals around the country, but we're in an environment that's smaller, that allows us to spend more time with patients, spend more time with their families, and give a lot more personalized care.
Family is key to being part of family-centered care. The team consists of the parents at the center. A lot of the nurses are probably 30 years and more. And most NICU nurses, once they come into the field, they usually stay here. End of a good day is basically having a baby who's been here for a couple of months go home, no respiratory support, feeding their feeds completely and looking perfectly normal. It's a great accomplishment. I mean, that's what we strive for. That's what you work here for.
The emergency department of Maimonides is one of only maybe a couple in the 5 boroughs that are able to provide the level of service and the scope of service that we're able to provide. We have an incredible cardiac team who we work very closely with. We have an incredible stroke team who we work very closely with. We're one of only a handful of adult and pediatric trauma centers in the whole city. We are the only pediatric trauma center for the borough of Brooklyn.
The reason we developed the Bone and Joint Center was to enhance the patient experience. Prior to what we have now, patients really had to go to several different places to get all their care. For instance, they had to go see a doctor in the doctor's office. They had to go to an MRI place to get an MRI done, go see a therapist at another location. And then if they needed other services, such as an EMG or ultrasound, they had to go to yet another place. And then if they had to have a surgery, they had to go to another facility to get their surgery. So we developed a Bone and Joint Center. And the concept was to put all those services in one place. Maimonides is my first job. I came here right out of my training. I was born in Brooklyn. I was born at Maimonides, and it's always been my hospital growing up.
You don't have to go anywhere else for your cardiac care because the best outcomes are right here at Maimonides.
Maimonides cares for more patients than anyone else does, and does it with an incredibly high level of care and an incredibly high level of commitment to their communities.
We are the hidden gem of Brooklyn. We definitely need to expand more, and I think we have more work to do here.
We have phenomenal clinical excellence that we deliver for patients every day. And that is we, that is you, that is all of us together. committed to and creating excellence that is competitive with Manhattan and the best in Brooklyn.
I've always had a concept that the people of Brooklyn deserved a better place to get their orthopedic care. I was born in Brooklyn. I was born at Maimonides Medical Center. I absolutely love Brooklyn. There's no place like Brooklyn in the world. People of Brooklyn are a unique group, and I think the group we have here fits that perfectly well.
So I'm actually a native New Yorker. I was born and raised in Queens. What I loved about orthopedics specifically is that you can make a tangible difference in someone's life and you actually see your result fairly quickly.
I want to make patients better, truthfully. I really want to see patients that weren't walking or having trouble walking, walk again. I want to see patients that play sports and can't play sports because they injured themselves, go back to their sport. So that's one of the most rewarding things that I have.
When we treat patients, we're not just treating an x-ray, we're not just treating what we see or an extremity, we're trying to treat the whole patient.
I think that's very important. Bedside manner is how you connect to the patients.
There's not one patient that can come in here and not feel like they're at home and feel like they can get the care they need. We're very sensitive to cultural demands of our communities, and I think that's what separates us from a lot of other practices.
This is the only facility where we provide both orthopedic care as well as spinal care in Brooklyn.
Pediatrics, trauma, reconstructive surgery, oncology.
What we're trying to create here is kind of a one-stop shop for orthopedics.
It's a very pleasant, modern, clean, happy, bright place.
A full team covering pretty much every aspect of orthopedics and sports medicine.
I feel the facility is excellent. We offer a very good quality of orthopedic care.
We strive to be the best in New York at what we do. We like to focus on patient care and want to make sure they understand what's going on, and more importantly, that they're part of the process.
The Bone and Joint Center is an all-inclusive, comprehensive center for all of your orthopedic care.
After my residency, I became a faculty at NYU Hospital for Joint Diseases, and I practiced there for 15 years. I recently became the vice chairman of this department, and the reason for me to come here was to give a bit more to the community in Brooklyn. I've been involved in this residency in Maimonides since 2008, and my goal always was to produce and encourage more residents to come to our program. And I'm hoping by being at Maimonides full-time at this point to be able to do a better job to attract good residents and to teach better residents.